All right, ladies and gentlemen, boys and girls, folks of all ages, thank you for spending your Wednesday night with me at 7 for 30 minutes. We're going to do resilient hips and how to get them. Welcome. Let's get it started, shall we? All right, this workshop, it's for you if you have hip pain with running, or you feel a pinch in the front part of your hip when you're squatting at the bottom of your squat, or you want to unlock your hips and improve your glute strength. We'll find out how tonight. Or you don't have any problems. Your hips are fine. You want to keep it that way. If you've had other problems, hopefully you've solved those in our past workshops: shoulder, back, knee, neck. Now we're going to do the hip. All right, things you'll learn tonight. We're going to learn how to find your ideal squat position, your ideal squat width. You're going to learn the most important muscle in the hip. It might not be what you think it is. And also, we're going to talk about 3 key hip mobilizations you can do on your own. All right, how do you mobilize the hip? It is a deep ball and socket joint. We want to make sure that we can mobilize that. All right, and then also 2 key strengthening exercises. I added those in late, or like probably yesterday. I just edited that in, called an audible. I said, you know what? We got to strengthen this one muscle that's so important. I'm going to show you how tonight. All right, and the correct way to do it, because everybody butchers this exercise. They want to think, oh, I want to work on my glutes, pump my rump. You got to do it right. All right, so what's in it for you? You improve your performance, reduce and eliminate your pain, even if you have back pain. We're going to be talking about the hip, but if you have back pain, all the stuff that we're going to do tonight might eliminate it. It's funny like that. We're going to be running more efficiently. Learn how to run more efficiently, less effort, right? And then get rid of your hip pain and soreness. All right, so this is an important note. This is not physical therapy. What we're going to be talking about is just general advice that I have given some of my patients and clients over the 20 years that I've been in the physical therapy field. This is good general advice for a broad audience, but it might not work for everybody. All right? I never want to bring a fitness answer to a medical question. So you might take these things that we're going to talk about and think, all right, that's the answer. I'm going to go do that. But you know what? I want you to contact me personally if you're dealing with a specific issue, because you know what? I want everyone to be better, get back to doing the things that they love to do without pain, restrictions, pain medication, injections, avoid surgery, even if you've had physical therapy before. So I give out free consultations. All right. So this is targeted at a broad audience. If you want to get better, you have a specific problem, contact me. We can get through a customized physical exam and develop a treatment plan so we can get to the root cause of your problem. All right. Now, if you stay to the end today, there'll be a giveaway. All right. I forgot it at home. I have it at home. I wish I could see you physically, show you physically, but it's at home. I forgot it. I had to lug all my stuff here, but there's going to be a giveaway that's going to help your hips. All right. So if you don't know me, my name is Dr. Paul Cho. I'm the owner of Par 5 Physical Therapy here in Randolph, New Jersey. I specialize in orthopedics, golf fitness, and rehab. And like I said before, I want to help active adults move better, feel better, and play better. So again, if you've been to the other sessions, this is the theme. If we're going to do any stretching or anything that we're going to show tonight, you got to do slow. Don't push through pain, and breathe. All right? Breathe properly. You exhale twice as long as your inhale is in through the nose, out through the nose, to tap into that rest and digest parasympathetic nervous system so that you can relax the muscle that you're stretching. Don't hold your breath. Rinse your face when you're stretching, because that just feeds into the cycle of making the muscle tight. All right, so here's the thing. If this is your first time, this is a video that kind of explains how the body works by this joint-by-joint approach. The body functions on this alternating pattern of stability and mobility, starting from the foot up. All right? If this pattern of stable, mobile, stable, mobile, stable, mobile, if this pattern is disrupted, then pain or injury is going to be the result. All right? The body is very good at compensating. Your body knows movement. It doesn't know muscle. So if you say, all right, I got to activate this one specific muscle with this one movement, It doesn't matter. Your body's going to be like, all right, whatever it takes for me to get from point A to point B, accomplish the task, it's going to do it. Now, in particular, tonight, we're going to be talking about the hip. The hip is going to be classified as a mobile segment, a mobile joint. And a lot of times, if hips get tight, the body starts to look for mobility elsewhere. It'll look above, upstream in the lower back. It'll try and make the lower back or your core mobile when it should be stable, or it'll make the knee, which is supposed to be stable, unstable or more mobile. So the hip has to be mobile. All right, so every week we also do this pre-test. One of my treatment philosophies is that we do a pre-test, a treatment, and then a post-test. If the post-test remains unchanged from your pre-test, then whatever you did in the treatment, whatever intervention did not work. You have to have some type of change or there is no change, a measurable change. So this is the pre-test. If you've hung with me since the beginning, we've done these two tests before. We've done the squat test and we've done the hip extension test. So let's take a look at these again as a review. The squat test. So it's basically getting your feet shoulder width apart, hands over your head, and then squatting down. So what we're looking for, the key points I'm going to show you is foot position, right? Can we keep the feet straight? And then with the hands over your head, squat down, getting the hips below your knees and the hands directly over that foot line. Okay, so that's the overhead squat. If you can't do that, then we just take the hands out of it, put your hands across your chest, try and repeat that same squat. If you can improve the depth or the quality of the squat, then it's not then it kind of points to a problem in the shoulders or the upper back. So that's the squat test. How is your squat? Everybody get up, you're sitting down looking on your phones, your smartphone, your iPad, your computer, stand up and do a squat. If your squat looks like this dude, awesome, right? Now, it's always good to have somebody look at the way that you squat. Either you have a mirror or you have somebody looking at you from the side profile, seeing where does the hands go, right? They use the stick there. It's easier to measure. But are the hands over the feet, right? If they can't stay over the feet, if they're tilting forward, then we just take that out, put the hands across your chest, repeat it again. Do you get your hips below your knees? All right, next one. Hip extension, right? Again, use your smartphone, use a mirror, use somebody else at home to look from the side view. We're going to get their feet together, hands overhead, bicep to ear, and then we're going to bring the belly button forward and hips back. What we're looking for is that the front part of your hip, the ASIS, for those who know, this little pointy spot in the front part of your hip, as you go backwards, that should pass the toe line. That should go right in front of the toe line. And the shoulder blade should pass the heel line. All right, we're looking from the side. And there should be a uniform curve of your back. A lot of times people will come in who sit a lot and they could pass this test, but it looks wonky, right? They get a lot of the extension through their lower back and not a lot of hip extension. And the reason being is because if we sit, our hips are flexed, they adaptively, all that soft tissue in the front adaptively becomes short. And then when we ask it to extend and straighten and go backwards, that's tight. We're just working our body against our own selves. So again, back to the car analogy. It's like driving a car with a parking brake on. All right, you can slam on the gas, rev the engine, but if you have that parking brake on, you're losing a lot of power and causing a lot of damage. All right, you want to open up the front part of your hip to be able to extend and activate the glutes. All right, so what is your ideal squat position? Everybody's anatomy is different. What is the ideal squat shape for you? Not everyone can get their hips below their knees. Why? I'll show you. All right, now, but if we're looking at the hip, we're concentrating on the hip tonight. We're going to look at the hip in this next slide. But we also have to consider when we do the squat, there's a knee involved and there's a foot and ankle involved. Foot and ankle we're going to cover next week. The knee we've done in the past. So go back to that video if you have any questions about this. But this is the hip. It's a ball and socket. It kind of fits in there into the pelvis. But as you can see, it has like a little angle. We call it the neck, right? It goes in there like that, all right? That angle is pretty easy. It just looks like this, right? That angle, easy from the front. But if we turned this model on its back, and we look straight down the skeleton. So this is looking from the front of the skeleton. We have that angle, that neck. But if I turned your body like this, that angle is not flat like that. It's actually tilted up. Angle of aversion, for those who know, right? So everybody's angle is different. And that changes how that ball articulates in the hip and changes how you can squat. What is your particular perfect squat position? And then, you know, if we look at the foot, what's your foot, your ankle mobility? That will dictate also if you could squat successfully. All right, so this is our next test. I threw this in. Seated hip internal and external rotation. Now, quick little test. Close this down. I'm going to sit down. Hopefully you can see this. I'm sitting down on my table. What you're going to do is find somewhere where you could sit and your thigh is parallel. If we put like a fist under there, that'll help keep your thigh parallel. And what you're going to see or try and do is, without lifting up a butt cheek, keep your body straight. Try and rotate that foot in as far as you can. So I've got this other leg out of the way. Rotate that foot in as far as you can. Can you get to 45 degrees? And then try it the other way. So this is external rotation. Even though the foot's going in, we call it external rotation. And then rotate that foot out and see how far you can go. I cannot get to 45 degrees going the opposite way. My internal rotation is going to be tight. So what does that say? People who have more internal rotation, if you can get that foot out 45 degrees and not get it in 45 degrees, that might point you to say, possibly, there's a lot of other things, but if we had to make a generalization, that might mean that you are more biased to a narrower squat stance, versus if you have a lot of external rotation, that would bias you to a wider squat stance. So this guy's showing external rotation. He's rotating his foot in, and then he's rotating out, internal rotation. So more internal rotation, you're biased towards a narrower squat. And then more external rotation, you're more biased to the wider squat. And that's just the angle, that's just your anatomy, right? Don't try and force yourself to go too wide if you have like this great internal rotation. So the other thing we want to look at is passive range of motion. What does it look like when you bring your knees into your chest? So again, let me reposition my camera. I'm going to get on the table. And if you're lying down, what you're going to do is keep your back straight, keep your head down, and then you're just going to bring your knees into your chest, right? And we want to feel, where can I lift my knees without lifting my tailbone? I want to keep my tailbone down and purely feel, what does my hip do, right? And then if I use my hands to help, if I squeeze in nice and tight, what does that feel like? If I go wide, again, we did that external rotation test in the slides before. I'm biased with a wider stance or wider knees, right? And if you feel tight, or bring your knees in and it doesn't feel good, if you feel a pinch, take note of that. We're going to talk about that in the next slide. But you feel where you're comfortable. And that is going to be your ideal squat position. You're going to look down. Where do your feet go? Where are your feet pointing? If they're pointing out at 45 degrees, then we have to look below the knee in future workshops to see what that is. But if your toes are pointing out maybe about 10 to 15 degrees off center, that's okay. All right, that's passable. But look at where your feet are when you have that comfortable knee up position, and that's how wide your squat should be. All right. Now, we talked about that pinch. If you pull your knees into your chest in that position on your back and you're feeling a pinch, try this. This is a weight-bearing thing, position that we just did. So that knee into chest, you flip it on over, you get yourself on your hands and knees and you walk back. You got to keep your back straight when you come back, right? So we're basically going to assume the same shape, the knees the same width, keep our back straight, don't round out, and then let the hips go down. And feel, does that get rid of that pinch that you got? And I'm going to bring my knees in a little bit closer and see if I keep my back straight. Does that improve how it feels in the front part of my hip? What does that tell us? That tells us that there's probably a joint alignment centration problem as the hip comes up or as the knee comes up, right? So if that ball stays in the middle of the socket and rotates up, if it stays in the middle, we're all good. We got no problems. But if that ball rotates and slightly comes up and abuts the front part of the socket, that sometimes will give you that pinch. Is it a joint problem or is it a soft tissue problem? That we have to kind of test a little bit more. But if you notice the difference, if the pinch is gone, then it might be a joint problem. All right, but what's causing the joint problem? Is it a joint issue, truly a joint issue, or is it tight structures in the front part of your hip that are pulling that joint forward? Chicken or the egg question, right? Chicken or egg? Which came first? All right, so we covered this in the back workshop and the knee workshop. It's a hip flexor test. It's basically hanging off the end of the table. Let me just check who's in here. Yeah, I think everybody has seen the hip flexor test before. It's just basically off the edge of the table here, hugging the knees into your chest, making sure that's nice and tight, and then lying back and seeing what that leg is doing. Like if I'm relaxing this leg, is it parallel? Is my thigh parallel to the ground? And also, can I get 90 degrees at that knee? That's passing. If not, then that means that we're tight, which could also limit the ability for your glute to work. And this is where we're coming into the most important muscle of your hip. What is it? Any guesses? We got 2 other PTs in the workshop right now. They should take a break. What's this? Iliopsoas? That's what you said? Really? All right. I'm going to say. All right. So this is the most important muscle of the hip. Oh, look at this. Wait a second. I got like a question and answer. Yes. Somebody heard a pop when they did that rocking back. Now, one, if there is popping, is there pain associated with the popping? And did it repeatedly lock up the joint? If there's no pain with the pop and the joint doesn't feel like it's locked up, then you know what? That pop could be a number of things. It could be a tendon rolling over a bony surface, or it could be gas in the joint popping, or sometimes it's like a suction, like a pop that if you plunger a toilet, a joint cavitation. Great answer, Roxy. If you suction a plunger and you pull the plunger out, that pop, that might be it. Let's see here, verify. If hip external rotation is more than internal rotation, tendency is towards a wire strand squat. That is correct. Correct. No pain associated. Awesome. That is good. Yes. I like all of that stuff that you guys are writing in here. So, what's the most important muscle of the hip? Well, let me show you this first. This is what typically happens for people who sit too long. This is called the lower cross syndrome, okay? Most commonly, we find that this weak gluteus maximus is associated with the weak abdominals, and the tight iliopsoas, the tight hip flexor, is associated with the tight erector spinae, the right tight lower back. What does that mean? It means that if you're trying to extend the hip and the front part of the hip is super tight, the glute is not going to be able to fire. It's reflexively inhibited. All right? And then let's look at the anatomy. So we got the glute max, this big thing in the back. It's like your big butt cheek. The most important muscle is the glute medius. It's underneath, okay? The king and queen of the hip, we call it. The king is the glute max. The queen is the glute medius. And it's very, very important. I think it's more important than your glute max. The glute medius is more important than your glute max because of this thing. All right? We spend a second or a millisecond when we're walking in a single leg stance position. If you are running, you do this thousands of times on your run. All right? And if you're doing lunges, if you're doing any exercise that is single leg and you do not have good control of that gluteus medius, like walking, stairs, lunges, running, you can have either back pain or lateral knee pain or lateral hip pain. Okay? Because from this picture right here, it shows what happens when the glute med doesn't fire. We've got a tilt of the pelvis, and that changes everything upstream. But it could also create an inward tilt of the knee, which can cause lateral knee pain as well, and a tight IT band, or technically a tight tensor fascial ladder. But that's for the knee workshop. You should go see that. All right, so hip mobilizations with the band. We've got 10 more minutes. Hopefully I can get through these. So we take a super band. A super band is this thick rubber band. For the hip, I use it, it's about 1.5 to 2 inches wide. And you wrap it around something sturdy because it can generate maybe about 150 to 200 pounds of pull force. And you get into the front of your hip. This is an anterior capsule, hip capsule joint mobilization. You can do this at home. You wind up in this hip flexor half kneeling stretch. You generate tension with your body position, and then you relax. Don't fight the band. Don't pull against the band. Allow the band to pull your hip forward. And you hold this for 2 minutes. All right? Contracting the abdominals, contracting the glutes so that your trunk and your hip are stable, but you allow the band to pull your pelvis forward to stretch out that anterior hip joint capsule. Now, if you have that pinchy feeling in the front part of your hip and that hands and knees rock back movement felt good, then I would take it to the next level with this. This is a banded distraction, mobilization with movement into that bottom squat position. You can see the position of my spine and the shape of my body. It's going into the bottom of your squat. And as you go into the bottom of your squat, that band is pulling laterally sideways to gap that joint a little bit. So it takes the pressure off, the compressive force out of that joint, which facilitates normal muscle, normal joint movement. You do that for 2 minutes. And then you follow up with the next one. This is the end range squat position. We basically go all the way up into end range hip flexion. We've got a pull that's lateral, sideways, and a little bit back, so it's diagonal. And then you're doing this for 2 minutes, trying to push that hip into external rotation. All right, if you still have pinching with the quadruped rockbacks, did you day? It's a joint problem? Did you say it's a joint? You know what? That's the thing that you would dive down deeper. If you're still having a pinch with those rockbacks, it might be a joint problem, right? And then we figure out why is there a joint problem. Then you would go to this. If you do the banded distractions and it improves it, then yeah, it's going to be a joint problem. But I think we have to look at that hip flexor. You have to look at the rectus femoris. You know, those types of muscles in the front part of your hip, if they are congenitally short or adaptively short, they'll pull that hip capsule forward, or they'll make the front part of your hip capsule tight, and then you'll get that pinching chronically. All right, so these are the things. Gluteus medius strengthening. What do you do for gluteus medius strengthening? So there's a whole ton of exercises that you can do. Just Google gluteus medius strengthening. You'll probably have like pages and pages. But these are the 3 things that I think are the most important when you do any type of, when you want to target that muscle. The hip has to be straight. The hip has to be internally rotated. So if you took your foot and stood on your foot and then rotated it so that the heel is out and the knee and the foot's pointing in, that's internal rotation. And your knee has to be straight, okay? Any other position, the TFL, the other muscles will help and compensate. So this is one that I like to give us tactile feedback. This should play. It's a sideline hip abduction against the wall. Whoa, this guy's talking. All right. So against the wall, shoulders and pelvis are going to be flat against the wall. That keeps your body very perpendicular to the ground. And then you rotate or you lift the leg up. Now, as you rotate or lift the leg up, you don't rotate. The foot remains parallel to the ground. All right. That is the one to target that gluteus medius. Another one that I like, let's get back over here, is this wall plank or whatever. I don't even know what you call it. It's basically just standing on one foot, getting the side of your body against the wall. The only thing that should be touching your wall is your side of your knee or your shin, right? You're standing up nice and tall. The arm is free. It's not touching. And you're just holding that position, right? You're trying to keep your back straight, your trunk straight, and your pelvis straight. And then that will activate your gluteus medius. All right, a lot of single legs. So these are just some examples. There's a ton more if you want to go down that rabbit hole. But we got 6 minutes. Got to finish up. All right, so what happens when you strengthen the gluteus medius? Another question comes up here. If you have difficulty tailor sitting for long periods of time, crisscross applesauce, what are your thoughts? Well, I'll tell you one thing is that I'm thinking, what is it, sartorius? joint capsule restriction. And then we look upstream, downstream. Where is the pain? Where is the discomfort, right? Is it anterior, front, or back, side? And what is like a Faber test? How is that, right? Do a Faber test, see what happens. Do you have pain? Is it a joint or is it soft tissue? So that is another, that question right there, if you're having difficulty sitting crisscross applesauce, that is, yeah, there's a lot to unpack because there's a lot of reasons why you cannot do that position. And I would check if you cannot do a Faber. That's a special test for those of you who are non-medical. You should also check your angle of anteversion. Look that up, angle of anteversion, and that'll determine if you have the requisite physiological range of motion in the hip itself. Hopefully that answered your question. If not, see me after class. All right, so we've got the benefits of the gluteus medius. And then, let's see, click on to the next slide. A few words about the rotator cuff. Yeah, so I've got 4 minutes and see if we can get through this. So the hip, just like the shoulder, is a ball and socket joint. You know the shoulder has a rotator cuff. The hip also does have a rotator cuff. And there are exercises, they're called controlled articular rotations, CARs, which can help improve the strength of the rotator cuff and improve that joint centration or joint alignment. I'll give you one example really quick. So hands and knees, right? This is our quadruped position. Again, back remains neutral, and we're going to try and rotate through the hip only, all right? Isolating the hip, not extending the back. We're just going to keep that knee bent and then bring that knee up. All right, once we get to extension, we're going to rotate that knee out, thinking about drawing a large circle with the knee without rotating through the pelvis. And we can do this around, right? So you probably have seen this before, just like hip circles, right? Well, we could turn this up by adding rotation. So I would externally rotate, bring the knee up and around, try and get it big up into my gut, and then rotate it up and around also. And then once I get past parallel, internally rotate, try and bring that knee up nice and high, and then bring it back to the start. So that rotation, controlled articular rotation at those end ranges, that is just one example. You could also do that in standing and other positions as well. Google CARs if you are interested. It's a whole other thing as well. All right, so after all that, 2 more minutes, post-test. If you do some of the mobilizations, there should be a change in your ability to squat or your ability to extend through the hip. If there isn't, we got to do more things, right? If there isn't a change, a measurable change after your intervention, then nothing happened. Okay, so, but if you are dealing with knee pain or hip pain, if you're dealing with any pain, give me a call, all right? If you're already in pain, I mentioned the free consultations earlier, these discovery visits, right? It's basically 30 minutes where we don't do a full evaluation, but it's not a, it's a conversation, a deeper conversation, a deeper chat about your pain, your symptoms, your goals, what makes it worse, what makes it better, so that you can make an informed decision of whether or not it's something that I can fix and it will be a good fit, all right? I never want to have anyone start a treatment plan with me if we're questioning whether or not I'm going to cure you in 4 visits. 4 to 6 visits is usually the average. All right? At least every session, I want people to feel at least 50% better. Next, this is a recap of what we learned. Closing it out, we've got 1 more minute. Hip joint mechanics, the perfect squat position, hip mobilization with the band, and strengthening of the queen of the hip, the gluteus medius. Now, for those of you who continue to attend each session, this is what's going to happen. Next week, at the end of next week's session, we're going to raffle off this thing, the Trigger Point MB Vibe vibrating massage ball. All right, so there's a couple people. Let me check the list. There's a couple people that are still in the running. All right, but for now, let's get this back here. But for now, what are we going to do? We're going to raffle off this thing. I had it at home. I don't have it with me. But how do we figure out who wins? I've got the list of attendees, and we do the drum roll. What I do is I get this random number generator from, how many we got? 8 people. I want to get 8 over here. 8 and then 1. So numbers 1 through 8. 1, 2, 3, 4, 5, 6, 7, 8. All right. Now, I will say this, is that there have been people here. 2 of you have won in the past weeks. I can't have you win again. I'm sorry. We have to give a chance to someone else. So if the number lands on your number, I'm going to roll again. Okay? Here we go. Random number generator. You can see that. And I'm going to hit the button. What's the number? 2. Who's number 2? Geez, Louise. I'm going to have to go to what? Long Island? Jennifer, you're the winner. Number 2. All right, we got to figure out how to get this thing to you. If you want it, you could stay behind, put in the chat. We got to get some information. How am I going to ship this to you? So congratulations on winning the Trigger Point Grid Foam Roller. If you don't have one, it's great. Congratulations. All right, let's finish up. Thank you guys for sticking with me. This workshop series is basically about enabling people, empowering people to have no more aches and pains, right? Nobody wants to live with aches and pains. No more stiffness. Avoid injury. Enjoy your time with your family, your friends, and just be more resilient and confident. That's my goal for you guys. That's my goal for everyone. All right? So this is my phone number, my contact information. If you do have any questions, I'm going to stay on to answer them, and then we'll straighten things out to finish it up. Again, thank you so much for hanging out with me for the past 32 minutes on a Wednesday night. Hopefully, I see you guys all next week for the foot and ankle. We're going to wrap up the Resilient Body Workshop series next week. Thank you so much.